So good day everyone, my name is Asudari Mangatong, a nursing student from Notre Dame of Tabarang College. So today I'm going to demonstrate the prenatal care and Leopold's maneuver. So the equipment that we're going to use is the tape measure, mother baby book, tetanus toxoid vaccine, and the 3cc syringe. So our first procedure is to identify the client and explain the procedure to prevent errors, disenhancing client to be cooperative and fund his confidence, and also assess the client's health history, which includes personal, family, social, previous obstetrical, and present obstetrical data. Rationalist information gathered by healthcare provider will help establish baseline data and identify the teaching needs. And the next procedure is assess the client's knowledge on guidelines for health pregnant and antepartal care. Rationale is to provide baseline data and to identify the teaching needs. And also review the plans for antepartal care visits, examination, and laboratory findings uh, to serve as a baseline data for succeeding the prenatal care, and monitor the vital signs of the client to provide baseline data and the future comparison and identification of factors. Next procedure is measure the height on initial visit and monitor the weight in succeeding the visit. So weighing is an important part of each prenatal examination. And uh, next procedure is conduct a physical examination, begin assessing from head to toe. Rationale is to come with the general impression of woman's health and well-being. Next procedure is instruct the client to empty or void her bladder to promote comfort on the part of the client, and also position the client in dorsal recumbent position. Proper positioning relaxes both mother and the baby, and it also facilitates the easy location and presentation lie of the fetus. Next procedure is drape the client and expose the abdomen from the level of the xiphoid process down to the symphysis pubis. Rationale is to provide privacy and measure the funding height using tape measure starting at 0 centimeter. So to determine the gestation and growth of the fetus. So i-measure natin ang funding height ng ating patient using the centimeter. So start at the top sa bottom. So ang fundic measure ng ating patient is 34 centimeter. So next procedure is the centimeter side of the tape measure must be facing the abdomen while the inch side is facing the examiner. So rationale is to prevent bias, and also locate the highest point of the fundus, leave one hand in place, and secure the end of the tape measure to the fundus. Rationale is to measure the fundic height correctly and document the measurement in centimeter to compare with the calculated stations. Next procedure is perform the Leopold's maneuver to assess the condition and fetal presentation. And also the next procedure is warm two hands by rubbing one against the other hand before placing them on the abdomen. So the use of warm hands during the palpation prevents tension and hardening of the abdominal muscles, favoring good results. Next procedure is perform the four maneuvers. During the three maneuver, the examiner stands at the side of the client bed and faces the client. So the position favors accurate performance of the maneuvers. So the first maneuver that we're going to perform is the fundal grip. So with both hands, we have to palpate the upper abdomen of the fundus for consistency. So mobility and rationale is to determine the fetal part lying in the fundus. So papalpate natin. For the second maneuver that we're going to perform is the umbilical grip. So with both hands moving down, palpate the sides of the uterus from the top and top to the bottom, one side smooth, hard resistant, and surface. So rationale is to determine the fetal back for fetal heart tone, usually found in the left lower quadrant. So, papalpate natin yung side by side ng full tip ni mother. So the third maneuver is the Pollick's grip. So with the right hand over the symphysis, identify the presenting part by grasping the lower abdomen with thumb and fingers. So rationale is to determine engagement of the presenting part. So sa lower part naman ng abdomen ni mother. So the last maneuver that we're going to perform is the pelvic grip. So the nurse alters position by turning toward the patient's feet. So with both hands, assess the descent of the presenting part by locating the cephalic prominence of throw. So rationale is to determine the degree of flexion of the fetal head. So next procedure is reposition the client so to make the client feel comfortable. So ika na mother, position na. So next procedure is administer the tetanus toxoid vaccine following the recommended schedule. First is the TT1 or tetanus toxoid 1, TT2, 3, 3, 4 to 5. And rationalis prevents both the mother and newborn from tetanus. Next procedure is administer iron folate supplement until the second month of postpartum, so to regain iron loss during childbirth. And also administer the malaria prophylaxis to all pregnant women in endemic areas as ordered by the doctor. So give the tablets of chloroquine phosphate 250 mg every week for the duration of pregnancy. Rationally, women are most likely to develop malaria when pregnant. And also provide and promote health teaching on good nutrition, personal hygiene, and enough rest and sleep. So to ensure an optimum environment for health growth and development. And next procedure is discussed with the client her expectations about pregnancy, which includes the danger signs of pregnancy, labor, or delivery, and the impact on the family. So rationale psychological assessment is important to assist the client in identifying areas of need to ensure optimal fetal growth and development. And also plan with the mother the preparation for breastfeeding the baby to know the advantages of breastfeeding to newborn and discuss the importance of prenatal and subsequent visits for follow-up care. That's all. Thank you.